So I'm going to extract the tooth. I'm going to place my implant. I'm going to use that mesial bone. And as you can see here, I even have a big papilla on the mesial aspect, right? And I have a socket that is kind of like a drifted distally. What I'm going to do, which is very important as we mentioned before, is I'm going to need to debride and clean thoroughly this granulation tissue, which is granulomatous tissue that affects also the mesial root of this number 7. So I'm going to fully fill that socket by also treating periodontally that mesial root by scaling root planning. If you have chemicals or bioactive modifiers such as amdogain, this will also encourage the cementoblast formation for new periodontal ligament regeneration over that mesial root of the number 17. So the day of the surgery, we extracted the tooth with laser implant. We used a customized heating abutment that would fully fill all the socket. We used a single suture on the distal aspect, as you can see. This is after a week. If you see some particles of bone, it's better to remove them. And if you see some residual food as well, it's very important to remove it, because you don't want to leave any kind of residual organic or inorganic element that might trigger a foreign body reaction. In addition to it, it is very important to mention to your patients that for the first 7 to 10 days, they must have a liquid diet, non-semi-solid diet, liquid diet. They're gonna hate you for 10 days, but the wound is gonna love you, okay? This is after 3 weeks. And look at the day that we are going to scan. As you can see, you have a mesial papilla that is very wide and a distal papilla that is basically connecting to the mesial aspect of the tooth. So what I did was I used a PMMA crown that was designed by the lab to compress a little bit mesially that mesial papilla.